Good afternoon, ladies and gentlemen. I'm MPP Mike Colle, the Member of Provincial Parliament for the riding of Eglington-Lawrence. And we're here for a press conference just prior to the introduction of a bill, which will happen this afternoon about 3 o'clock. And the bill is called the Pregnancy and Infant Loss Awareness, Research and Care Act. With me today on the stage, you'll hear from them briefly, is on my immediate right is Michelle Lafontaine, who's the chair and board of directors of the PAIL network. Welcome, Michelle.
Thank you.
Okay. And also on my far right is Wendy Moulsdale, who's pediatric nurse, practitioner, intensive care unit, Sunnybrook Health Services Center, education chair for the PAIL network.
Thank you.
Welcome, Wendy. And PAIL stands for the Pregnancy and Infant Loss Awareness Network, which has been in existence for over 25 years, PAIL. On my immediate left is Jamie McCleary, who's a mom and a PAIL network volunteer. Welcome, Jamie.
Thank you.
And we also have many members of the PAIL network here, many moms and families and fathers that are here. And I want to welcome them all to Queen's Park to take time to be here today. The bill that I'm about to introduce talks to a very critically important health issue. And it's a health issue that many of us are very uncomfortable in talking about. It's sort of a health issue that affects thousands of families and mothers across this province and across Canada every year. But because of the cultural taboos, because of the social mores, very little attention is given to this vital health issue that needs attention. And this health issue that needs attention and is crying out for attention is infant loss, which occurs at various stages of pregnancy, everything from miscarriages to stillbirths to children dying immediately after the mom gives birth. And there's essentially a real gap in terms of the comprehensive approach to helping mothers and families go through this tragic health situation. There's a lack of medical coordination sometimes in hospitals, from health practitioners of all kinds. There's also a lack of counseling support that is needed very much by mothers and families who experience infant loss. And in this bill, we're trying to essentially put this health issue on the agenda of the public to make them more aware of the need to do more to help bring research dollars, to bring counseling support programs, expand them for mothers and families who experience infant loss. Also, it's an attempt to try and bring awareness to the media about this issue and how it affects everything from mental health to physical health to family breakup. These are the types of things that we're trying to do with this bill. Bring awareness, bring some attention, bring some resources so that organizations like the PAIL network can have more resources, more comprehensive programs that are easily attained by mothers and families across Ontario in a comprehensive way. And the medical experts, and you'll hear from Wendy Moulsdale, who's a pediatric nurse practitioner in a moment, but I know in talking to Dr. John Kingdom, who's the chair of gynecology and the pediatric health at Mount Sinai Hospital and other doctors who have written letters of support. They all agree that there is a real serious challenge here, because despite all the modern technologies in healthcare, all the investments in prenatal care, and the incredible work some of our doctors and nurses and health practitioners do, the incident of pregnancy and infant loss is not reducing. There's no abatement. It still continues to affect thousands of mothers every year. And the questions are being raised: why is it occurring? What are the causes? How do we compare with other jurisdictions, like across Canada, the United States, in the rest of the world? What are some of the best practices employed or deployed to improve the health of mothers and in pregnancy, and also give them the best counseling if they experience infant loss and pregnancy. So the doctors and the experts and the mothers that I've talked to all agree that we have to put this silent subject and the silent suffering of mothers and families to an end. We have to allow for frank, wholesome discussion and information about this serious health issue, which affects thousands of mothers and families every year. So this bill, if passed, would establish a comprehensive program of research in conjunction with the Ministry of Health. It would undertake a comparative analysis to understand the factors that may increase the risk of pregnancy loss and infant death. It would develop and expand existing programs to help reduce the risk of pregnancy loss or infant death, and develop and expand existing programs in Ontario to provide counseling and support for mothers and their families. There are programs in existence, but we need more investment to expand these programs to make them available from people all over Ontario, from Kenora to Cornwall, from North York to North Bay. And also, we want to look at the best practices comprehensively in all international jurisdictions to see if we can incorporate them here in Ontario. And in closing, I'll say we have some of the world experts in this whole area of prenatal care, obstetrics, gynecology. They're all here, and many of them reside just down the street here in the Mount Sinai Sick Kids Health Corridor here. We have Dr. Matthew Surmer, Chief of Obstetrics and Gynecology at Mount Sinai, who agrees this is a very needed and overdue initiative, which he supports. Dr. Gareth Seward, who's the professor and vice chair of Department of Obstetrics and Gynecology at the University of Toronto, says more resources are needed to allocate province-wide programs and also to support mothers and families and fathers through this emotional traumatic journey. And also from Dr. Prakash Shah, who's the professor of the Department of Pediatric Institute of Health Policy Management at Mount Sinai. He says, I believe that the strength of the proposed bill that is before us here lies in its two-pronged approach, commitment to preventative strategies and support for those who have experienced miscarriage of stillbirth. So the medical experts all think that there needs to be attention given to this. As I keep saying, it's a serious health issue that needs resources. The good news is that already I've had discussions with many of my colleagues here at Queen's Park, a lot of MPPs from all parties. I've also talked to the Minister of Health, Dr. Eric Hoskins, who's very supportive of this initiative. In fact, we already have the invitation to have a meeting with some of the leading experts in this field from the medical community, along with members of the PAIL network, to sit down with the top bureaucrats in the Ministry of Health to try and come up with some immediate steps we can take to start to coordinate some of these responses and to find out where the gaps are and to hear from the people on the ground, like some of the people here, but what can be done immediately, even before this bill goes through all its stages. And the last comment I'll make is I've had a number of these bills brought before over 25, 30 bills I've introduced, a number of them have become law. Some of them become a law unto themselves and are passed as direct bills. Sometimes the government will take the ideas out of this bill and incorporate it into their mandate without the bill actually passing. So this is a great opportunity for all of us to put this important health issue on the radar of our health ministry officials, of the media, of the public, so we stop the suffering in silence and we get people the support they deserve and the supports they need to get through this life-altering experience for many mothers and families. So I thank you for listening. I thank everybody for being here. And now I would like to pass it over for their comments. First, as I said, is Michelle Lafontaine, Chair, Board of Directors of the PAIL Network. Michelle?
Good afternoon, and thank you to Mr. Colle for including pregnancy and infant loss, or PAIL Network as it's more commonly known, as you prepare to introduce this bill. I'd like to take the next few minutes to tell you a little bit about pregnancy and infant loss from the perspective of a bereaved mother. We lost our twin babies at 20 weeks gestation, a boy and a girl. The grief we suffered was immeasurable. There were days I thought we would never experience any joy in our lives ever again. I ached for my babies. I felt this sense of detachment from the rest of the world, like I didn't belong anymore. What had happened to us was something unspeakable. We had absolutely no idea how we were going to live with this tragedy. We learned about PAIL Network through a friend who knew someone who experienced a loss. We connected over the phone, and for the first time since losing my babies, I felt like someone actually understood. I began attending peer support groups and learned that my feelings were very common for those who have experienced pregnancy or infant loss. I'd like to share some of those commonalities with you now. Parents who have experienced a loss have to learn to live how to incorporate their intense grief over the loss of their baby with the intense love they feel for their baby. They will grieve deeply and they will love deeply. The two are not separate. Parents who have experienced a loss will never get over it. There is no recovery. They may look like they have their life back together. They may go on to have other children, but the baby they lost and the trauma they experienced is always one step behind. The third thing that families who have lost a baby have in common is the deafening silence that surrounds them. Friends disappear, co-workers avoid them, and society does not want to talk or think about such a tragic loss. The family's world has been shattered, but no flowers are sent, no cards are given, and no one dares to ask, "How are you?" People simply don't know what to say or what to do. Families who have lost a baby will never replace that child. Having more children after a loss does not ease the pain, does not make it any better, and most certainly does not replace the baby who has died. It doesn't matter if that loss was an early miscarriage, a full-term stillborn baby, or if the baby dies hours or days later. The place that baby holds in the family's heart can never be filled. Parents who have lost a baby will always live in a parallel universe. No matter how much time has gone by, when a holiday or an important event occurs, the parents who have lost their baby will wonder what it would have been like if their baby was with them. They know how old their baby would have been. They imagine what they would have done with the lives that were never realized. In speaking with a PAIL Network volunteer this week, he told me a powerful story. His mother, who is 74 years old, recently disclosed to him that she lost twins more than 50 years ago. She went on to have 3 more children afterwards, but admitted that not a day goes by that she has not thought of her twins. At PAIL Network, we have heard this from thousands of parents, time and time again. Their baby is never far from their minds and always in their hearts. Parents welcome the opportunity to share their baby with others, to speak their baby's name, to be in the company of those who will honor the short but meaningful life their baby had. This need for connection has never been more evident to us, as our peer-led support groups have grown from 11 groups in 2014 to 27 peer-led support groups across the province in 2015. For all the families we have helped, there are thousands more that we have not reached, and we believe that change is on the horizon. The introduction of this Pregnancy and Infant Loss Awareness, Research, and Care Act, and the awareness it brings to this issue could be the catalyst for change in Ontario as it pertains to access for services for bereaved parents when they have experienced the loss of a pregnancy or a baby. PAIL Network is the leading organization in the province, and we hope to ultimately introduce standards of care that would allow parents the same rights and access to services that are automatically given to parents who have given birth to a healthy baby. Parents are discharged from the hospital with a healthy newborn, along with information about how to contact their local public health nurse, lactation consultant, and are seen by a physician within 3 days of leaving the hospital. Parents who leave the hospital after their baby has died are empty-handed and in shock, yet expected to seek out support they need and somehow learn how to reconcile their loss and accommodate the loss of their baby into their lives. Stronger partnerships with Ontario hospitals can guarantee that these parents receive the follow-up care they need from trained support providers, and the opportunity to connect with other parents who can share in their pain and begin to provide them with the hope that they too can learn to live with their loss. In closing, I'd like to say that on behalf of all the families and volunteers of PAIL Network, we believe today is an incredibly important day. Today marks what we hope will be a crucial first step to transforming the lives of mothers and their families across Ontario by giving them the support they so desperately need and deserve.
Thank you ever so much for those very powerful words, Wendy. And I was especially struck by your reference to the call for standards of care and equal access to health care. And that is, I think, something we've got to get out to the public loud and clear. Because I don't think the public or the media, or even the healthcare profession and the Ministry of Health officials know that there is a real sort of two-tier system of, helping mothers who have a successful pregnancy and ones that suffer the tragic loss. So that, I think, is something we've got to emphasize over and over again, and hopefully that the media out there will get this word out that, we're not going to stand by and let this continue. And as much as it's about grieving, we also want to stand up for the rights of mothers and families who go through pregnancy loss. So thank you so much for your very powerful words.
Thank you.
Next is to speak is Wendy Moulsdale, and Wendy is a pediatric nurse practitioner out of Sunnybrook, and she's been working with the network, training health professionals, doctors, first-line health people on this need to bring some best practices in terms of helping mothers. I know you've been doing some incredible groundwork all over the place, Wendy, so thank you, and would you go ahead then?
Thank you. Good afternoon, everyone, and thank you, Mr. Colle, for the opportunity to support the Pregnancy and Infant Loss Awareness, Research, and Care Act that I am confident will enhance the care of women and their families in Ontario who experience pregnancy loss and infant death. PAIL Network is also looking forward to collaborating with you and with the Ministry of Health and Long-Term Care. I believe that this bill is an important step to begin to share our 25 years of collective experience, knowledge, and clinical best practices to help establish standardized care for families across the province. And thank you, Michelle, for your powerful and inspiring words. As a nurse practitioner, I have personally supported hundreds of families experiencing the loss of a baby to stillbirth or neonatal death, and I have taught more than 600 healthcare professionals across this province about how to provide compassionate bereavement care to women and their families. I believe it is crucial that we make pregnancy and infant loss a priority healthcare issue. As Michelle so poignantly described, when a parent loses a baby, a long and emotional journey of grief and loss begins. And while grief may change over time, the loss and the pain remain. Certainly the first step towards trying to find answers is to raise awareness about this widespread medical reality and to conduct more research into the reasons why 1 in 4 pregnancies end in loss. But while we search for the answers, what we can focus on is helping the families now and educating professionals, including doctors, nurses, social workers, midwives, ultrasound technicians, doulas, funeral home directors, and so many more who come into contact with these families. They do already call PAIL Network year-round for training and advice about how to deliver compassionate care to those who are suffering from this tragic and traumatic loss of their baby. And we provide them with that knowledge and best practices about how to support families experiencing loss, how they can work through their grief, how to communicate with families in a caring and sensitive way, and to provide some awareness about the resources that are out there. So as the lead for education for PAIL Network for the past 2.5 years, my team and I have worked tirelessly to reach healthcare providers all over the province with a key message, and that is, when we know better, we do better. But sadly, as we've traveled the province, we continue to hear sad stories like these. A 38-year-old mother is lying in her hospital room grieving the stillbirth of her baby girl when the nurse walks in and asks, "Why aren't you with your baby?" We want this to stop. Or a 30-year-old woman who walks into the emergency room with severe abdominal pain and bleeding, and she tells the staff that she's pregnant. And the doctor says to her, somewhat nonchalantly, "Oh, you're probably miscarrying. It happens all the time. We'll send you home with a kit, and you can always see your own doctor next week. You can always try again." We want this to stop. A bereaved couple whose first baby died at 23 weeks gestation, and now they are in a subsequent pregnancy. They've come to the clinic for an ultrasound, and the ultrasound technologist comes into the room with a happy expression on her face and says, "Oh, hi, is this your first baby?" We want this to stop. A key component of this bill is to support women and their families experiencing these tragic circumstances, and to achieve that, there is an urgent need to educate healthcare providers all across the province. PAIL Network has brought our programs across the province to both large and small communities, and we know we're making a difference now, but there are so many more we need to reach, because thousands of families don't know where to find help, and they are so desperately in need of that help and support. The feedback from our workshops has been overwhelmingly positive. Healthcare professionals feel much better prepared to care for bereaved families. They have the tools to talk to families, to help them learn about their emotions of loss and grief, and they recommend our program to their colleagues. But there is still that gap out there, and we do need to do as much as we can to reduce the suffering that goes on. More communities need to hear our message that families must receive sensitive and compassionate care, and that care needs to be informed by the best evidence and knowledge about the impact of grief and loss on the lives of the parents and the lives of the family and siblings. And we know that contact with these families goes far beyond hospital walls, and we sincerely hope that this bill will be a catalyst for change. And in closing, I would like to reiterate again to remember that when we know better, we can do better. Thank you very much.
Yeah, thank you so much, Wendy. And as you said in a very compelling fashion, is that sometimes the callousness and the lack of awareness is quite shocking. In our modern, state-of-the-art healthcare system, that we still have this double standard and these gaps in our healthcare system, and I don't think it's it's not a malicious thing, but it seems to be just a total lack of appreciation of this. That's what I've been finding, is they just don't understand. Like, I know we contacted a health reporter about this initiative today or the other day, and they said, well, this is not really a health issue. this is a lifestyle issue. And this was a major health report. So, and I don't blame them. I mean, this is something that, they talk about the glass ceiling, but, I think we've got a real, almost a organized silence about this that needs to be broken so that we start dealing with it in a comprehensive way to allow people to understand this without being afraid to speak about it. So thank you so much. Next is Jamie McCleary, who's a mom, and Jamie is also a volunteer with the Pregnancy and Infant Loss Awareness Network. Thanks for being here, Jamie. Would you like to speak?
Thank you very much for having me and for spearheading this crucial bill. I'd like to read a quote I'm sure most of you will recognize. "I'll love you forever, I'll like you for always, as long as I'm living, my baby you'll be." Many of us have recited these words, curled up with our children in our lap, and it's easy to see why Robert Munsch has managed to create one of the most recognized pieces of children's literature. The lesser-known truth is that Robert Munsch didn't write those lines for his children, at least not directly. Those words were written as a song he sang for his children that were stillborn. Like many in this room, I'm a parent. I'm mom to 5 phenomenal little people. I carried them inside me, gave birth to them, held them in my hands, and brought them home. 2 of those walks were in the front door and out the back to bury those babies, my sons, who died inside my body. My husband and I were so ill-prepared for the intensity of our loss the first time it happened. Our grief over a son we had never seen, yet we knew so completely. Perrin was born at 13 weeks gestation, a forced induction, 2 days after we learned his heart had stopped beating. I was never the same again. There was so much anger, disbelief, piercing pain, and such darkness surrounding me that I thought I would never feel light again. Even the process of mothering my 2-year-old daughter was painful, knowing what I would never experience with my little boy. I had a physical ache inside me, and aside from my husband, no one else seemed to care. We were isolated, totally removed from everyone and everything to be alone with our grief. I needed to be pregnant again. I needed the weight pushing down on me, to be my child in my arms, not the void where one was supposed to be. I was still raw with grief when we found out we were expecting again, and now the terror that I'd lose another baby I loved so desperately threatened to overpower my joy. I tried to focus on the positive, and our baby made it easy, wiggling and kicking and displaying his personality from the moment he could make his presence known. Slowly I began to relax. There was no way it could happen again, until it did. At 18 weeks, during a routine appointment, I found myself trying so hard to just keep breathing while my midwife struggled to find my baby's heartbeat. It was quiet. We spent 3 days in and out of the hospital emergency room, being sent home and brought back for another ultrasound, another opinion, another plan. I pray every day that no one ever has to go home night after night and told to sleep with the child they love more than words dead inside them. Matson was born quietly in a hospital while my husband and I hid away in our room, surrounded by babies crying. His body dropped in a bucket of water on the table in my room. Seeing my beautiful baby boy reduced to medical waste, having to reach in and fish him out just to hold him, to see his face, is quite possibly the worst thing I have ever experienced. I will never forget what that felt like. In the midst of grieving, struggling to find meaning, the anger, isolation, and rejection I felt from the rest of the world, I found the Pregnancy and Infant Loss Network. Walking into a room full of parents who knew what I was going through, who cried with me, was like a salve on my heart. Knowing that whatever I needed to go through to allow my grief to progress wasn't wrong was a weight off my shoulders. Being able to talk about my boys started the long and never-ending process of healing. I applied and was accepted into the special pregnancy program at Mount Sinai Hospital in 2009, 1 year after Matson's death. The most phenomenal team of doctors and support staff guided me through 2 more pregnancies and 2 more incredible little boys I am beyond blessed to be able to tuck in at night. I don't know where I'd be without any of those people. I do know I wouldn't be here. The journey to this very room has been long and exhausting, but also one of the most meaningful. I made the slow and terrifying trek across that line from bereaved mother with the PAIL network to volunteer. I put my kids to bed some nights and make phone calls to newly bereaved. I let them tell me about their babies, let them cry, and help them begin their path to healing. I have a purpose now besides being a mom and a wife. PAIL has become my passion, advocating for parents and the babies they have lost, raising awareness on the reality and the intensity of baby loss, and doing my very best to make sure that no one else has to suffer alone through the worst experiences of their lives are my goals. It shouldn't be so hard. Mothers shouldn't have to weep at the computer, desperately trying to find someone to talk to. Fathers shouldn't have to slip off to the bathroom to let their own tears fall, trying to be strong for their partners. Parents shouldn't have to be so terrified of feeling that pain again that they never try to have another child. Help should be there always, and organizations like the PAIL Network should not have to fight so hard to reach those who need them. But with awareness comes support, with support comes help, and with help comes healing. Grieving the loss of a child never stops, even after 8 years, as I can personally attest. But I'm stronger in my grief, more settled with the place Perrin and Matson have in my life and my family. There are still nights I cry for them. Thanks to PAIL Network and Mount Sinai Hospital, my grief is no longer crippling. It doesn't take my breath away or leave me cold anymore. I want that for all of us who have walked in the door and straight out again to bury their child. We all deserve peace, and that peace is attainable with a little bit of help. No one can do it alone, and we need to make sure they don't have to. Thank you.
Thank you so much, Jamie, for your very powerful and eloquent words, really
you.
poetic, tragically poetic. I mean, it's extremely heartfelt, and I really commend you for the strength and the power of your words, really. And I guess the bottom line, and I think what Jamie has said, mothers and families shouldn't have to fight so hard for the health care and the respect and the support that they deserve. Right now, it is almost, there's a Berlin Wall of ignorance almost out there. And this modern, province and the cities we live in, yet there's almost a refusal to acknowledge that we have to do much better in giving mothers and families the respect and the support services and the medical support that they so rightfully deserve. And it's not happening right now. And that's why, hopefully, out of this initiative here, we can start to break down this wall, which is, I think, causing undue health issues and just not knowing why, despite all the modern technology, we still have so many pregnancy and infant losses in this world of digital medicine. I mean, we've just opened a new digital hospital up at Keele and Wilson, the Humber River. Totally digital, totally state-of-the-art, but yet every day mothers, families suffer infant loss, and they don't know why. And like I've asked the question, I've said, how many infant loss and pregnancies are there in Ontario as compared to New York State, as compared to California, as compared to Sweden or England? Well, they don't really know. There hasn't been any research done. And what are the best practices that are deployed in different countries that we could deploy here? What can we do better? Which hospitals have the expertise, which don't? As you said, I think, where do you go to find this out? It's almost, unless you have involvement with the PAIL network or you're at Mount Sinai, there is expertise, but then some family, mother with a child loss in Cornwall, Ontario, what do they have there? Who do they go to? So we've got to bring this to the attention, and hopefully the media won't be afraid and so reluctant to talk about it. I mean, I just can't understand the silence of the media. Whether they're not interested, they're too busy, but I think the media reflects the public. We almost are afraid to, or not comfortable in talking about it. So we just can't blame the media. We have to look at ourselves and the medical community to do more, the ministry officials. So that's what hopefully this proposed legislation will do. It'll certainly push all of us to get this equal attention and help in this very, very challenging field of health for mothers and their families and the infants that they carry. So, in ending, I want to thank all of you who came, the mothers, the fathers, the three wonderful spokespersons that were so articulate here today. And I just want to say that I am very optimistic that we can break down this wall with your concerted efforts to let people know about this bill, to encourage people to, I'm going to have petitions ready, to call your MPPs, to call the Premier's office, call the Minister of Health, let them know you want something done. And I think they will respond if we are out there letting them know we need this help. So, and even in the process of getting through the legislature of this bill itself, we're going to succeed in getting help to mothers and families who suffer from experienced infant loss and pregnancy. So this is I think, a very optimistic journey we're going to be on because of the strength of you all. I can see that we're going to be successful. And I just, will do everything I can with your support to get this wrong and this wall broken down. This wall of silence has got to be broken down, and we need everybody's help to do that. So thank you all so very much for being here today.
So why did you decide to bring this forward? I'm sorry if I missed it, if the scrums were still going on. Was there a personal reason for you?
Yes, in my family I've had infant loss.
Sorry to prod, but yourself or
My
children?
daughter.
And so I'm actually just wondering if you guys could all tell me your names again so I have them all. And are you all here with PAIL or?
Yes.
Okay. So I know you're Jamie.
Jamie McCleary.
Okay. And
Michelle Lafontaine.
Wendy Moulsdale.
so Wendy, you're a nurse as
A
well.
nurse practitioner,
A
yes.
nurse practitioner. Okay. So in your experience from the medical side of things, are there associated costs and detriments to the healthcare system by not addressing this issue?
Oh, definitely, definitely. A key area that perhaps we didn't really touch on is when the bereaved couple need to return to work and the delay that can ensue there because of the mental anguish. So they can experience something called disenfranchised grief, which means their grief is not acknowledged and is maybe not dealt with, or they haven't had an opportunity to be supported as they work through their grief and their feelings of loss. And so imagine that the father or the partner needs to go back to work maybe even the next day or a week later, and imagine that situation of going into the workplace and how non-productive he or she probably will be from the strain and the pain of the loss.
So when you observed the difference, I thought it was really interesting. I hadn't heard much about the counseling at Mount Sinai, but have you observed a bit of the difference between families who get access to that and those who don't? Or maybe one of you might be able to speak
Yeah, I might
to.
defer that to Michelle and Jamie.
For me, it was very positive because they acknowledge the fear after the loss. So I was able to go in every few weeks for ultrasounds just to confirm that the baby was growing and he was healthy. I was able to speak with the perinatal psychiatrist in Mount Sinai So we had the counseling supports and we had the physical supports. They did testing of all natures, trying to find out if there was a specific reason that not only did I lose my babies, but that they died so similarly. So it was very comprehensive, and it was they made it easy, well, as easy as it can be to go through a pregnancy after that. So I don't know how I would have gone if I hadn't had that or access to that at Mount Sinai.
How unique is that Mount Sinai program? Like, are there a couple of them? Or?
It's very difficult to find anything like that. I did some internet searches afterwards when I was trying to find someone to speak with, and there are very few that I came across. I did come across a few individual doctors who would do some testing or what they could, but because Mount Sinai is so comprehensive with the cardiology units and the obstetricians and the ultrasound and psychiatry, it's virtually impossible to find that anywhere else that I was able to see.
I could perhaps speak to that at Sunnybrook there is a high-risk obstetrical unit and a subsequent pregnancy program that has been highly successful and meaningful for families. We certainly see improved care in the fact that as these babies perhaps come to me in the neonatal intensive care unit, I see a very well detailed history provided by the advanced practice nurse that helps run that clinic, so that I can then be immediately aware of the increased need for support and sensitivity for this family, and then I can alert the team in the neonatal ICU about their previous losses and how we need to especially surround them with support as they fear the loss now perhaps of this premature baby that's been born.
So the goal is to have that more coordinated and more equitable access across the province.
For sure.
And you hear that statistic all the time that the 1 in 3 pregnancies end in some kind of loss, but it's not something women talk about. It's not something we learn about in health class. But there has been a really recent, I'd say in the past 6 months to a year, more and more public conversations about this issue, and sometimes linked into the debate about IVF funding, sometimes standing on their own. Wondering if you guys have any sense if something's actually changing, or if people have just been picking up on that because we have been talking about funding, especially in this province, funding IVF.
I think as far as awareness across the province, we can certainly tip our hat to social media for a lot of that awareness. Some of the events that we host at PAIL Network are commemorative events that we invite families to, and by posting on Facebook and tweeting about it, we definitely have gotten the word out that way. I also believe that when we're looking at other areas of funding that are being introduced, such as you mentioned the IVF coverage being brought forward, that anytime there's a conversation about potential pregnancy or potential pregnancy loss, then we do as volunteers at PAIL Network try to get our voices heard. So certainly any of the events that we've hosted or any of the media releases that have gone out, we do try and spread the word to our network of volunteers. But again, it's very difficult to get more awareness across the province, and anytime there's an opportunity, we like to take it. I think the other part that we maybe didn't touch on so much is how it impacts on the rest of the family as well. That primarily we do hear a lot about mothers, but those mothers don't live in isolation. They are part of a larger family, so there are certainly impacts on the economic well-being of the rest of the family, never mind the psychosocial needs of the rest of the family as well.
There is a bit of a taboo or maybe a stigma in trying to talk about these issues. I mean, I found out after the fact that friends had gone, or relatives or acquaintances had gone through pregnancy loss, before having a successful pregnancy, and they didn't really talk about it then or going through it. Or if you do hear, it's not like there's like a Hallmark card for this kind of grief, right? Is there a way to improve the way we talk about it with people, like the way those social networks around a grieving family can better help them? Because I think sometimes if you're on the outside looking in, you don't know what to say or what to do because there isn't that social script like there is for a more traditional death?
I think a lot of it is beginning with the parents and the families themselves, because as we do go into organizations like PAIL, and as more and more things like the peer-led groups develop, more and more people are accessing their own feelings and their own processes, so they're more comfortable in their grief and their position in the rest of society, and they're more able to walk out and say, oh no, I have 4 children instead of 2 children. So the bereaved families themselves are the ones starting the conversations, and everyone around is sort of saying, oh, okay, they're willing to talk about this, so maybe it's okay. And then it's a ripple effect, because now these people know that it is something that they want to talk about.
So you yourself called yourself a mother of 5 children?
Yes.
Yeah.
And could I add a key step to that then is to educate the frontline healthcare providers in the many different settings across the province where they encounter bereaved families, not only the hospital setting, because it's the healthcare provider that can assure the parents the feelings you're having are normal. It's okay, and we encourage you to talk about your baby, to name your baby if that is culturally your choice, but we want the frontline healthcare providers to be able to reassure the parents right from the discovery of the loss that we can be a support and a resource to them. And then when they leave the healthcare environment, they already have a few tools with them to help them through.
And this might be a good question for Michelle, but do you think people sometimes minimize early miscarriages versus someone losing a baby that's, full term or essentially?
Absolutely. I think, speaking from personal experience, I had my loss. I have twins at 20 weeks and 5 days. At the time, I was working for a nonprofit organization who was trying to be helpful, and in doing so, sent a letter to clients of mine to let them know that I had had a miscarriage. And to me, having a miscarriage, having babies at 20 weeks or having babies at 39 weeks, a loss is a loss. And we at PAIL Network just this year have really tried to focus our efforts on those early losses. We do have printed materials available for the public, and we really have tried to focus some of that awareness so that parents who do suffer a miscarriage are perhaps given additional bereavement time from work, that workplaces and the rest of society can be a little bit more sensitive to what that loss would feel like. I think what really stands out for the bereaved loss community or for the bereaved parents community is that there really is no word to describe what's happened. When you lose a spouse, you're a widow. When parents are passing away, then you become an orphan as their child. But there's no word to describe what happens when you lose a baby or lose a child. And so really we're trying to explain to everyone around us, starting with our immediate circles, how intense that loss is, so that we can continue to move forward in the healing.
So how did PAIL get started?
Wendy, I can pass to you.
Oh,
for that.
sure. In 1992, a group of bereaved parents who actually were experiencing their losses quite close together in the NICU at the Hospital for Sick Children realized that stepping forward into the world, their community couldn't offer them any support. So as they were 4 couples together, they decided to band together and that they were going to do something.
And then you got involved after your loss.
Yeah, and I think, the other piece of it for me was that I didn't become aware of PAIL Network from my healthcare providers. When I left the hospital after having my babies, my husband and I went home, and that was it. There was no follow-up appointment. There was no phone call a week or 2 later from the hospital or from my healthcare provider. It was, as I had said, a friend of a friend who knew someone who experienced a loss. So it's all very, very underground still about how people come to know us. Again, social media is helping with some of that we can get the word out about our very existence. But for the 37,000 families in the province that we are able to support, there are so many more that don't even know that we exist.
So you guys help 37,000 families a year, or there's 37?
There's 37,000 families across the province who experience loss. As far as how many we support individually, we don't have good data to support that particular number because there are times that it could be a phone call, they could be heavily involved for years, so we don't have good data to give you.
And Mr. Cole, is bereavement part of the bill itself?
Yes,
Bereavement
that
time?
we're calling for more comprehensive investment in counseling programs. I mean, PAIL has had a small grant from the Trillium Network, but I mean, that's a drop in the bucket considering the thousands of families that go through this every year. And I'd just like to say that, I've been an MPP for 20 years, and I've seen thousands of bills related to health care, you name it, I've seen it. I've debates, all kinds of initiatives, committee meetings. In 20 years, I've never heard of this subject being raised. So I think that tells us there's something very wrong, that this serious health care issue is not raised as a subject in the provincial legislature of Ontario, whose main mandate as a provincial government, it's not just talking about this government, I've been here through the Conservative, all governments, its mandate is healthcare. Half of our budget is healthcare. And not to ever have any attention paid to this serious health issue over all these years, I mean, it's something. It's just astonishing that maybe it's basically a reflection of our society and why we don't talk about this serious situation that occurs and the effect it has and the need to do research and find out why it happens and what the impact is and how. If we don't talk about it, we're not going to get the attention. So I'm just so passionate about saying we've got to start to put this on the table as a serious health issue that needs money, that needs attention, that needs coordination, and it's got to be done. We just can't let this go on.
So I guess my last question would be on the research side, talking about causes. We track very, very significantly infant mortality rates. It's actually a World Health indicator, right? And have done a lot of work in relatively recent history on what vaccines and early things like that are given. Maybe from the medical perspective, maybe you have some insight. What kind of research is out there? Like, is this really a massive gap in sort of our medical knowledge?
Well, I know with me it was extensive testing. There was the genetic components, and then there was it was specified around the type of loss that I experienced. But it was something that we had to pay for out of pocket, and it's very expensive testing. And it's not entirely comprehensive. So we got to the point where our testing was done and no results were found. So they decided they'd err on the side of caution and they'd treat for one that they believed it could be, but there's no evidence for it. So the testing is expensive, and if that's something that can be covered or handled by the government, then it should be available to other families who maybe can't afford to have all this testing done to find out why they keep losing babies.
In terms of the research that is out there, we know that there's quite a lot of good research going on about the causes of stillbirth and how to prevent stillbirth. But to your earlier point, I think there's quite a paucity of good research about early losses, such as miscarriages and recurrent miscarriages. So I think there needs to be more funding and more research geared towards those questions. And definitely from a qualitative perspective, the lived experience of loss needs to be looked into far more through research in order to then articulate more publicly and more formally to people who, would take more credit if it's put forward that way, in order to break the silence, as Mr. Colle alluded to. That is something that research will help to prove and to raise the awareness.
Thank you guys for being so open about this. Thank you.
Thank you.
Proud of it.
Thank you for your interest.
Thank you.
Again, I want to say on behalf of all the families and mothers across Ontario that can't be here, for you speaking on their behalf, because you're helping all kinds of people who are not able to come forward like you have. So thank you so much, and the PAIL Network and everybody everybody that came here today. I think this is a very, very positive initiative we're on, and together we can get this done and break the silence. Thank you so much. Thank you.
Thank you.